All right, let's dive into a really powerful clinical example today. We're going to connect a specific inherited disease, cystic fibrosis, to a core concept in nutrition and see how it completely changes the body's ability to use a whole class of essential vitamins.
So you just finished covering how fat-soluble vitamins like vitamin K get absorbed, right? It's a pretty slick process, but it relies on everything in the digestive system working just perfectly. But what happens when it doesn't? What if a single genetic issue throws a massive wrench into that whole system? Well, that's exactly what we're going to unpack.
Okay, first things first, let's get a handle on the condition at the center of all this. Section 1. What is cystic fibrosis? It's an inherited disease, and its effects are, well, they're far-reaching.
At its absolute core, cystic fibrosis, or CF, comes down to a single defective gene. And the main thing that gene does wrong? It causes the body to produce this mucus that's way too thick and sticky. Now I want you to burn that phrase into your brain, thick, sticky mucus, because it is the villain in our story today. It's the root cause of every single problem we're about to talk about.
Now, most people hear cystic fibrosis and they immediately think it's a lung disease. And, it is, but that's not the whole picture. Not even close. It impacts systems all over the body. But for our purposes, for this whole nutrition conversation, we need to zoom right in on one organ in particular, the pancreas, because that's where the story of vitamin malabsorption really kicks off. So this brings us to our next section, the pancreatic blockage. And I love this subtitle, the domino effect, because it's the perfect way to describe what happens. We're about to see how that one little mucus problem starts a massive, cascading chain reaction.
And here are the dominoes lined up and ready to fall. It all starts with that one defective gene churning out thick mucus. Now picture tiny little pipes, or ducts, leading out of your pancreas. That sticky mucus acts like sludge and completely clogs those pipes. And what's supposed to be flowing through them? Crucial digestive enzymes. So now they're trapped. They're stuck inside the pancreas, unable to get out and do their job. And over time, this backup gets so bad it can actually damage and destroy the pancreas itself. It's basically a plumbing catastrophe.
Okay, so we've got trapped enzymes. Big deal, right? What in the world does that have to do with vitamins? Well, that brings us right here to Section 3, the fat absorption problem. This is where we connect all the dots between that physical traffic jam in the pancreas and a full-blown nutritional crisis.
All right, let's pause and recall a super fundamental concept from your studies. You absolutely need pancreatic enzymes to break down the fats you eat. Without them, the fat from that avocado or olive oil just can't be broken down into pieces your body can actually absorb. It's non-negotiable.
Okay, you see where this is going, right? Let's put those two pieces together. We know enzymes are essential for digesting fat, and we know that in cystic fibrosis, those very enzymes are stuck inside the pancreas. So what's the inevitable result?
And there it is, the punchline. The body simply can't digest and absorb fat properly. And here is the absolute critical link. If you can't absorb fat, you can't absorb anything that's dissolved in that fat. It's like fat is the bus and the vitamins are the passengers. If the bus can't get to its destination, neither can the passengers. And who are those passengers? Vitamins A, D, E, and K, the fat-soluble vitamins. They just get left behind.
And that brings us to the final and most critical piece of this entire puzzle. Section 4, the fat-soluble vitamin deficiencies. Let's look at what this actually means for a person's health. The very real, very serious clinical consequences.
So just take a look at this data. The impact is pretty stark. Vitamin A and K deficiencies are really common. And look at vitamin D. Deficiency is almost universal in people with CF. Now think about the real-world impact of that. A lack of vitamin A messes with your immune system, which is a huge problem for a group already prone to infections. And while vitamin E deficiency is rarer these days, its potential ties to disease resistance and heart issues can't be ignored. This is serious stuff. And this quote really drives the whole point home. The overall effect of not being able to absorb these nutrients is just devastating. Without really careful nutritional management, kids with CF face delayed growth and malnutrition. This isn't just about numbers on a lab report. This is about a child's ability to grow and thrive. It shows you just how essential it is to tackle this absorption problem head-on. So if you're going to walk away from this explainer remembering just one thing, let it be this. The whole journey of fat-soluble vitamins into your body is completely 100% tied to the journey of fat. If fat absorption is blocked, vitamin absorption is blocked. Period. And cystic fibrosis is just a dramatic and honestly unforgettable example of this fundamental rule of nutrition. You know, this whole situation really shines a bright spotlight on the Achilles heel of vitamins A, D, E, and K. They need fat to get into the party. Which leads us to a fantastic question, and it's a perfect bridge to your next chapter. What does this mean for the other guys, the water-soluble vitamins? How might their absorption be different, and could they be maybe a little more resilient to this kind of problem? That's definitely something to chew on.